we do that with endoscopic techniques.
What is endoscopic?
It means with a camera.
Oh,
so we can see underneath the skin.
Okay, okay. But it's not like a doctor doing a surgery with a robot. You're still using your own hands,
still using
correct?
Our own hands, correct.
Okay.
Still using our own hands. And we have special instruments that are long that can be used with the camera, but we're still using our own hands, not a robot.
Okay. Let's go to arm surgery. I have a couple of friends at the gym who says they've got their like fat suck out of their arms.
Right.
But Dr. Banks, I believe if you take fat out of your arms, you're going to have long hanging skin when your arms are done.
It depends on the elasticity of your skin. It's just like the tummy tuck. Some women can get liposuction alone for their tummy and they do great. If they have good skin elasticity, good tone, and the skin is going to retract after liposuction. Some women don't. If you already have stretch marks, it's unlikely that that skin is going to retract. It's already lost its elasticity.
Okay.
If you're losing weight very quickly or you have a large volume of liposuction, it's unlikely that all that skin is going to be able to retract. So for women who have lost a lot of weight, or losing weight, oftentimes the skin has been stretched, oftentimes the skin has lost its elasticity, and that skin will not retract back, and you will need to have the skin removed as well as the fat. Not everyone, but
what about
some.
neck lifts? I've had a couple of ladies want about neck lifts.
Neck lifts are often done in conjunction with a facelift for women who are getting a bit older and starting to have some looseness in the neck area. What's considered very attractive by most of us is to have a neck about 90 degrees here, very smooth jawline and a flat neck here. And so when we're losing that, we can tighten the neck with a neck lift, which means removing skin and tightening the muscle that's underneath the skin.
But where
so
do you cut on the face in
pain.
order to do the skin?
Behind the ears.
Okay. All right. Going back to tummy tucks. How long does it take to recuperate after a tummy tuck operation?
I tell people to take at least 2 weeks off from work. It very much depends on what type of work you do, but generally after the first week you're going to feel tight. You're not going to be able to stand up all the way because we do bend you at the waist in order to get you as tight as possible. By that second week you're standing up straight, but you might still be a little uncomfortable.
Let's back up. You bend the person at their waist when you're operating on them?
While they're asleep. Yes.
How do you do that? Just lift it up on the table?
We move the table so that the table's flexed, so the patient's in a semi-sitting position that allows us to take out more skin from the front of the trunk.
My goodness, and then you lay them back down and finish it.
Well, no, they actually stay in that flexed position until the end of the surgery, and in their post-operative period we also encourage them to stay in that flexed position while things are healing, at least for that first week.
Because I know when my sister came with me, she couldn't even hardly sit down to use the bathroom. She did a lot of crying. I'm not trying to frighten my viewers, but I want the truth to come out. That's what I want.
Well, I think that's why it's important to separate large abdominal procedures from cosmetic procedures, because cosmetic procedures in general they're elective. They can be done.
Something you choose.
Something you choose to have done. And in general, it's a very happy experience for women. It's something they've been waiting for and been thinking about for a long time.
It takes a lot of money
finally decided to have done. It's a costly endeavor. And we want them to feel like they've made the right decision and that they enjoy the experience. So we do try to not combine them with large necessary procedures, things like a hernia repair or other large abdominal procedure that is uncomfortable. It's already a lot to recover from.
Right. She also had a problem with trying to go to the bathroom. And she said that was very painful. So she talked to me till 1 o'clock this morning, telling me what to ask to because she went through it.
It would be interesting to know what the experience would have been for her if she had not had the abdominal surgery. It's hard for me to say what was due to the abdominal surgery and what was due to her tummy tuck, because I don't know exactly what type of hernia that she had. Certainly after you have a hernia repair, you can have difficulty going to the bathroom because of the anesthesia, or because of the increased abdominal wall pressure on your internal organs, or because you've had something done to your intestines aren't moving well. So it'd be hard for me to say.
But a regular tummy tuck with all that tightening and everything, that doesn't affect a woman's chances of going to the bathroom, having a bowel movement? It doesn't?
No. Now what does happen is from the anesthesia, your bladder doesn't squeeze as well. So for the first 24 hours, you might have some trouble going to the bathroom, trouble urinating.
She had a catheter. Put in her side and her right side.
Okay. We don't usually send women home with bladder catheters. They don't usually need them. We have them in during the surgery, but they come out at the end of the surgery. They don't usually need them. One thing that can happen commonly is because of the anesthesia and the pain medicines. A lot of women do get constipated because of the pain medication. That can be prevented.
Well, maybe that's what she was talking about. She couldn't pass her bowels.
That can be prevented if it's constipation with a stool softener. Now, if you've had a hernia repair, as I said, the hernia repair affects how your bowels work, and sometimes that's just a matter of waiting. That has nothing to do with the tummy tuck.
Okay. What about getting a brow, and we talked about the brow and forehead lift. What about getting the bust done?
The bust.
The bust, the breast.
And
do you do breast too?
We do breast.
Really?
We do a fair amount of breast reconstruction for women who have had a mastectomy or lumpectomy after cancer. We do also breast lifts, breast reductions, and breast augmentation.
What's the difference in a lift and augmentation, or bring down the size is what you're saying?
A breast lift doesn't really change the size of the breast, it just restores the youthful appearance of a woman's breast. So a woman that has now either breasts that are sagging a little bit lower than they used to be, they can be lifted. So that is to lift the volume of the breast higher and also lift the nipple higher. Breast augmentation means making the breast larger. And sometimes we do a combination of the two, which is called an augmentation mastopexy, which is to lift the breast
and put
an implant in. So that's a lift and an augmentation.
Okay.
So women who have either lost a lot of weight or had a few children, and they found that now their breasts are emptied out or sagging, sometimes they need to have the volume replaced and the breast lifted.
When you're doing a breast enhancement, would you go through the nipple? Do you just go around the areola, or do you go under the breast?
Either one.
Either one.
Depending on the patient.
Really? So I guess, what is the age you do a breast implants on? You don't do under 18, do you? A girl under 18?
Generally have to be over 18, and for some implants they have to be over 22 years old.
Why is that?
Because that's the FDA labeling for the implants.
Okay. Do you do still, are they back to the saline, or we're back to the...
Either one. Saline or silicone. Both are available now.
Silicone is back on the market, huh?
For everyone. It's never been off the market. It's always been available for breast reconstruction. There was a limited use for breast cosmetics, for breast augmentation. It was limited to women who had already had silicone implants.
Right.
But now we can use them for anyone. They're back on the market. We went through a lot of studies over the last 20 years to show they're completely safe. And I think they're a great implant. So depending on the person, I'll recommend a silicone implant, depending on what their needs are.
I worked with Dr. David Kessler back in the early 90s about the breast implant, especially the silicone. So much was happening. And I've never heard any, I know that we got what we wanted at the time. No girl under the age of 18 was going to be given a breast implant back then. And because there are a lot of parents, I don't know if you've met any, but if they're divorced and their daughter is going through a bad problem, she wants bigger breasts because that's going to make her life better. And a lot of parents was giving these kids the breast. They didn't need the breast.
Right. It's difficult to do any type of cosmetic procedure on someone who's very young.
Because they don't need it anyway. They're going to grow. They're
going to grow. Also, it's difficult. You don't want to do something on someone who's not able to make their own decisions.
Right.
So it's something that they can't undo. Although the augmentation procedure is a very safe procedure, it's certainly something I want people to have thought about and decided it's for themselves, this is what they want, and had an ample amount of time to think through the pros and cons before having an augmentation. Women are very happy, it's a beautiful thing to have done, but certainly, yeah, it's not for everyone.
I'm sure it's not for everyone, because I talked to one of my friends that she had it done, and she said her breasts were very, very hard, and that you have to actually massage your breast after breast implants in order to soften them up. Is that true? Because I don't think she'd lie to me.
Well, I don't know that massaging the breast softens them up, but what we do is we do encourage women to massage the breast to reduce the edema, to also help the implant settle into the breast implant pocket, and to prevent hardening. Once it's already hard, the massage doesn't really harden them up. But one of the most common things that can happen after breast augmentation is capsular contracture, which makes them hard. They're not normally hard. That's not normal.
What does the word mean?
Capsular contracture, it means excess scar tissue around the implant. That happens in about 10% of women. It's irregardless of type of implant, and we're not completely sure why it does happen, why it happens to some women and not other women. There's some speculation that it could be a subclinical infection, maybe a little bit of bleeding after the surgery.
What about blood clots too?
That can possibly be linked to capsular contracture. So once that happens, usually massage doesn't help get rid of it completely.
It doesn't.
And that can be the hard breast. That's not typical. That's not what our goal is. That's not expected. And certainly you shouldn't expect that after an implant, after an augmentation. The breast should be soft and supple. They should be soft.
Because, you know, sometimes women get too big though.
Do
you ever try to talk them down? To tone them down too?
Well, it's their body. But what I will tell them is that the larger you go, the more weight you're carrying on your chest. And usually we're getting implants because we want our breasts to be perky and round and to have a nice volume. Well, if you put too much volume in your breast, then it's going to make your breast sag faster than if you use a smaller volume. So there's choices to be made. We want